Hey everyone, this is Mayor Robert Garcia, and we're here doing our briefings. We always do the briefings at right around 3 p.m. on Mondays, Wednesdays, and Fridays. This is played, of course, on the Facebook page, on the Twitter handle, and also on Long Beach TV Spectrum Channel 3, and then we will replay it as well. Dr. Davis, who heads our health department, health team and medical team, is here with us. And she'll be answering some questions and getting a little bit more also in depth as it relates to some of the important health questions that we have today. And so these are all critical issues, and I want to kind of give everyone a preview. We're going to be discussing today some important topics as they relate to Long Beach. We're going to start by giving an overview of our cases in the city. Then I want to talk a little bit about what we're doing with people experiencing homelessness. And then I'm going to share also some news around our hospital capacity and what we're doing to grow there, which there's some good news there, and also some additional information about testing. There's some good news there as well. And then a topic that I know a lot of folks have been discussing in the news and as well as in homes, and I get the messages, are around facial coverings and masks as well. And so all of that are issues that we want to have a conversation about and hopefully answer some questions as well. And so let me begin a little bit of that. Want to first just start by the general update. So at present, we have 171 people in the city of Long Beach that currently are testing positive for COVID-19. We know that that's a number that obviously continues to increase day to day. We should expect that number to continue to increase. Of the 171 total cases that we have approximately 40 that now have recovered. And so that part is, of course, good news. We are very grateful that those 40 individuals are feeling better and are recovered. But I want to also make sure that people know that that 40 number is approximate. It's hard to exactly know the full recovery number, so we give that number as best that we can. But we do know that there's 171 positive cases as of right now. We also learned, unfortunately, earlier today that we had our third COVID-19 related death, which is, again, really sad. We have, of course, talked about the last two that passed away. This third death was a woman who was hospitalized that was in her 60s. She had underlying medical conditions, and so she had other health issues, but it's incredibly tragic in our city now to have lost 3 people to this virus, people that all have families, loved ones that are part of our community and our city, and so our prayers and our love go out to the entire family and the friends of all of these victims. I realize that this is a huge health crisis. We have other additional folks that are in the hospital and right now are fighting to get better, and we want to give them all of our love and support, as well as the doctors and nurses and medical staff that are taking care of them all. And if you want to help those people right now, you can do so by staying home, and that action saves lives. So please stay home if you can. I know that there are some essential workers, but for the rest of folks, people need to stay home. We know that there is a lot happening as it relates to these medical challenges, and I'm going to talk a little bit about those in just a minute. Before I do so, I want to just remind folks, if I am sometimes to and from places that I have to get to, I will see folks still not physical distancing, and that is unacceptable in this community. Everyone in Long Beach needs to understand that if we're going to do the right thing, you need to physical distance. You should not be in any type of gathering of groups. You should not be out hanging out at the park. You should not be out taking a walk at the beach because the beaches are closed. And so please, while a vast majority of folks are following the city's orders, those that are not need to stop being irresponsible and do the right thing and save additional lives, because those folks in the hospitals are counting on us. I want to transition now to homelessness and why this is an important topic. You probably are aware that for people experiencing homelessness, when someone becomes ill that is homeless or they need medical support, they almost always end up going to our emergency rooms. So you can imagine if we have any type of outbreak or a spread of COVID-19 within the homeless population, not only is one that tragic for those individuals because they are some of the most vulnerable people in our community, but it immediately causes a huge strain on our hospital system. So protecting and supporting people experiencing homelessness right now is not just about just doing the right thing for people that are homeless and ensuring that they have care and food and medical care. It's about ensuring that they don't end up overflowing all of our emergency rooms and hospitals that we need so bad right now to ensure that the most sick are being taken care of. And so it could really be an issue for us because for most homeless individuals, they don't have a physician that they can call. They don't have other type of clinics where they can attend or get advice or a home where they can recover. And so that emergency room becomes a critical piece of their healthcare process. And so I'm asking everyone to please support as we expand shelters across the city. It's for the health of the entire community. We have now opened our fourth homeless shelter in the city of Long Beach. This is now at Martin Luther King Park. This adds to the expansion of Silverado Park, which we opened just a couple days ago. We also have the North Long Beach, former North Library shelter that is also open, and the shelter that we have just west of downtown, which is now 4 complete shelters that are providing services and sheltering to people experiencing homelessness. And the most important part is we're following physical distancing rules. We are triaging folks as they come in and making sure that people are as safe as possible in these shelters. We know there's also a lot of people out right now that are on the verge of homelessness because of the economic crisis, and so we are all hands on deck as it relates to this issue, and there will be even additional sheltering that will be opening in the days ahead and weeks ahead, and so we'll have more announcements on all of that. Now I want to turn to an important topic, probably the most important topic that we have as a community, and that is our hospital and overflow capacity in the city of Long Beach. People are probably aware that we have some amazing hospitals in the city. We have Memorial, which is a huge part of a large health system. We have St. Mary's Hospital, of course. We also have College Hospital, which is a smaller hospital, but still part of our system. We have the VA, the Veterans Hospital, which is located in the eastern part of the city. And we are very close, as you've probably heard, an reopening community hospital. And so those hospitals, Memorial, St. Mary's, College, the VA, and community make up our Long Beach hospital system, especially in these critical weeks ahead. In addition, we know that Lakewood Regional Hospital and Los Alamitos Hospital, they're part of our system. They are sister hospitals to Long Beach, where there's a lot of communication and partnership at those hospitals. And we know that a lot of folks in Long Beach also access Los Alamitos as well as the Lakewood Regional. And so they're part of our broader system of hospitals. The city is in communication regularly, daily, hourly with our hospital system as we track the amount of beds available, the needs that they have, equipment that we know is critical right now, ventilators that we know is in short supply across the country, as well as the protective gear that our healthcare workers need. And we understand and know that there is a national shortage, which is shameful, I think, in I know all of our opinions. And so I know that our hospitals are doing what they can to get those protective gear and masks to them. We're also getting a lot of donations to our hospitals, which I encourage us to continue to do so, because we know that they need more. They need more of this gear, of the masks, of the gowns, to ensure that our nurses and doctors and medical teams are protected, because they are our heroes and they need to be protected. So what are we doing to expand capacity beyond that hospital system? We're doing a lot, and I want to start by sharing that the City of Long Beach and our health department has partnered to expand hospital capacity beyond not just the 5 Long Beach hospital institutions, but also our partners. We have, in partnership, set up additional hospital tents and overflow capacity at Memorial, at St. Mary's, and at College Hospital. What that means is that we have come in and partnered with these hospitals and set up additional tents outside their hospitals and are essentially ready to go, new hospital beds, recovery areas, additional places to do triage outside the hospitals, in their parking lots and on their grounds. So we have worked now to expand each of those 3 hospitals' capacity to anticipate the surge that we know is coming forward in the weeks ahead. Because as you've heard the governor speak, our number continues to increase in California, and we are preparing for the absolute worst case scenario. We are preparing to see if we get a huge overflow of patients. We want to have enough beds. And so now those 3 hospitals have tents outside their facilities. But in addition to that, what else are we doing? We're really proud to announce today also that in partnership with LA County, we have now going to be turning our convention center at the Long Beach Convention Center to an additional 100-bed overflow hospital and clinic at the Long Beach Convention Center. And so in a partnership with LA County, with the state, we are now setting up all of those beds on the floor of the former convention of the Convention Center and Pacific Ballroom to ensure that as soon as there is a need and we need to start moving people into other facilities, we have an additional 100 beds at the Long Beach Convention Center. That's also now happening at the LA Convention Center in Los Angeles. It's happening in San Diego, and we're doing the same thing because we can't wait for the emergency to be here. We've got to plan ahead. And I want to thank our team at the Long Beach Convention Center for their amazing work in getting this partnership in place there. And so that is another really positive in this expansion of health capacity at the Long Beach Convention Center. So we have the hospitals, the additional tents at the hospitals. Now we have the Long Beach Convention Center with additional rooms as well. We have another announcement today as it relates to our capacity, is that next week we are going to be opening up and establishing a mobile and drive-up clinic at Long Beach City College at the Pacific Coast campus. And so I want to start by thanking Long Beach City College. I want to thank their board. I want to thank their leadership there for working with us and to partner to open up this mobile clinic at Long Beach City College. And so what is this clinic going to do? It's a partnership, of course, between the city of Long Beach City College, the state, our county partners, and we will have, it won't be a hospital, but there will be clinical services there so that people can drive up, people can go there and get additional type of medical support. And then there's some good news attached to that. We are going to be next week opening up with our partnership with LA County, a drive up and drive through testing center at the same clinic location at Long Beach City College so that we have that additional capacity. And so what that means is that you're probably hearing or reading about these mobile clinics and testing sites that are starting to appear across LA County. There are a handful now, and Long Beach is going to be getting one next week. And that's a partnership with the County of Los Angeles. And I want to thank Supervisor Janice Hahn, who is working with us to ensure that clinic opens and that we have enough tests to test those that need it through our medical providers. What we'll be doing is we will be partnering with the LA County and City of Los Angeles online website that they've already created as a platform, and where individuals will be able to go on that website and sign up for appointments at the Long Beach City College testing clinic facility. In addition to that, I've had some questions about whether individuals from Long Beach can get tests at other locations outside of Long Beach. The answer to that is yes. And so starting this weekend as well, If you feel that you need to go get a test and you'd like to get one at one of these other clinics, you can go on the testing website through LA County, and later tonight, that website link will be available at the longbeach.gov COVID-19 page. So if you go to the Long Beach COVID-19 page later tonight, you'll be able to get on a link, and that'll take you to the website to sign up for the more mobile testing that is happening across the county, with the Long Beach Center opening up next week. Now, I think it's important to note that's just one way that folks are getting tested. Remember that Long Beach also has a drive-up mobile testing facility at the health department that's by appointment only for our hospitals. We're also testing at our lab at the health department for our hospitals. And we are testing with all of our private and public partners. Just a couple of days ago, we were already over 1,500 tests that we have done in Long Beach with our private and public partners. That number continues to go up. And once we start getting folks out to these county centers and our Long Beach Center next week, you're going to see testing really ramp up. Why is this happening now? Because as you're aware, we've had a national shortage of testing in the past, which has been really a shame for us and for this country. And testing companies, the CDC, are finally trying to catch up. So more tests are being proved, more tests are being made and sent to Long Beach, sent to the county. And so we're working to get as many people tested as possible. And so to review, we have our 5 hospital system, which is activated for a surge. We have the 3 additional tent hospital units who are ready for a surge. We have the 100-bed convention center additional hospital, which is being set up as I speak. And now we will be opening the Long Beach City College mobile clinic on the Pacific Coast campus on PCH, where you'll be able to also have the drive-up mobile testing, as well as some additional clinic health work. And everything I just described would not be possible without an immense amount of work from our city team, our health department, and all of our hospital and medical partners. It's been an enormous amount of work to get here, but we're feeling prepared. Doesn't mean that we're going to be as prepared as we need to be, depending on the surge, but we are prepared as best we can today, and we're going to continue every single day, every hour. We're going to ensure that we open more beds, more hospital capacity to make sure that we're prepared for what lies ahead. And I want to remind folks that this is the calm before the storm. We should expect a surge and a lot more capacity and a lot more people trying to come into our hospital system, and that's what we're preparing for. 2 additional topics, and then Dr. Davis is going to say a few remarks as well. There has been conversations around face coverings. There have been some conversations around medical masks and whether individuals should be wearing them or not. I want people to know that the CDC is beginning to put out some additional guidance and additional information as to what they recommend health departments to do and recommend. Dr. Davis is going to get into the specifics of that. What I will just say and share is that we are going to be launching by the end of this weekend a marketplace that is going to be in partnership with our media and community partner, the Long Beach Post. They're developing a technology and marketplace where all of the folks that are out there right now, that are at home, that are sewing masks, or small businesses that are making face coverings, cloth coverings, they'll be able to post those on the marketplace, and community members that may want to purchase them or interact with one of these companies can then find them on this marketplace. This does not replace the surgical masks, the critical masks that our healthcare workers need, because those will not be available on this marketplace. This marketplace is for homemade cloth type coverings that Dr. Davis is going to talk about in just a minute. But I want to thank the Long Beach Post, and that should go live before next week starts, that marketplace over the weekend, and they're going to be managing with that and partnering with the city on that marketplace. And finally, I want to thank everyone. We've had a flood of individuals and businesses that have asked, how can I help? How can we get involved in the work that's happening as we fight COVID-19? And we've shared in the past one way, which of course is the Coronavirus Relief Fund. That has raised over $500,000. People are texting support LB to 50155. That's support LB to 50155. And that is, of course, is raising money every day for nonprofits, food banks, other groups. But now there's an additional way to help. If you go to our COVID-19 page, and there is now a COVID-19 help section where you can go on and volunteer and sign up to help and assist this COVID-19 epidemic. And so we'll be launching that page later tonight, and we'll be putting out more information about how you can help us, for volunteers, for folks that want to just get involved and participate. And so I want to thank you all for joining us. And this is important information. And to get into more specifics, I want to turn this over to Dr. Davis. So thank you.
Thank you, Mayor Garcia. First, I want to assure our community that we're doing everything we can to keep all of Long Beach as safe as can be. Our epidemiology team continues investigating all of our 171 current positive COVID-19 cases, and we are now sharing information on long-term care facilities that have had positive cases as well. As of this afternoon, we've had 4 separate long-term care facilities with positive cases. We've been asked in the past how many cases are at skilled nursing facilities and assisted living facilities. And because these numbers are changing continually, rather than reporting the number of cases, we're going to follow what other jurisdictions have done and share a list on our website of facilities where cases have been reported. So you can look on our website for that. So now turning to face coverings, there's been a lot in the news, as the mayor mentioned, so I'd like to take some time to cover that. We'll be issuing a guidance soon for cloth face coverings, and that will be providing information for the public regarding use for face coverings. So the first thing that I'd like to note is that using a cloth to cover your face while you're out in public is not a substitute for the physical distancing and hand washing recommendations that we've been giving. The best individual and community defense against COVID-19, the best thing that you and I can be doing right now, is washing our hands, keeping our physical distance, not touching our faces, and adhering to the safer at home order, and really not leaving our house except for essential duties. Face coverings are not a replacement for these evidence-based measures that we know work. They're just an additional tool that may be used to protect us from exposure to COVID-19 when used properly. Using cloth face coverings may help to reduce disease transmission. Their primary role is to reduce the release of infectious particles into the air when someone speaks, coughs, or sneezes, including someone who has COVID-19 but feels well. So you may have already had the infection and only really have mild symptoms, and by wearing a face covering, it prevents your infectious particles from spewing out into the air and then infecting another person. N95 respirators and surgical masks are in short supply and should be reserved for healthcare workers to protect them while taking care of ill patients. Face coverings can be made of materials such as cotton or linen that covers the nose and the mouth. It can be factory made or sewn by hand, and as the mayor mentioned, we'll have a marketplace up later this weekend where you can order face masks. And we'll be putting a written cloth face covering guidance on our website soon. So I just want to remind everyone about the recent orders that we did on Wednesday. We issued 2 new health orders requiring individuals with COVID-19 to self-isolate and those at risk to self-quarantine. Anyone with or likely to have COVID-19 is required to self-isolate for at least 7 days after symptoms first appear and a minimum of 72 hours without fever or fever medicines, as long as your symptoms have gotten better. Anyone who has had close contact with someone who has or is likely to have COVID-19 is required to self-quarantine in a residence until 14 days from the last date that they were last in contact with the symptomatic person who had or was likely to have COVID-19. As always, please continue to check our website, www.longbeach.gov/COVID-19 for the most updated information. And if you have any questions, please call our info line at 562-570-4636. You can also follow at Long Beach City on Facebook, Twitter, and Instagram. Thank you and be well.
And we're going to go ahead and take a couple questions right now for Dr. Davis. Then after Dr. Davis does her questions, we're going to have a summary translation in Spanish that will happen from Alice from the Health Department. And also we have Paola right behind us who's doing ASL translation as well. And so we'll start with the questions for Dr. Davis.
Okay, our first question for Dr. Davis. Long Beach regularly releases the number of confirmed cases, but testing has been limited. So there's a concern that some symptomatic people are presumed to have the disease but aren't being tested. Can you discuss presumed positive cases and how those are handled in the city?
So the testing has been limited, as the question mentions, for quite some time, and we are going to be ramping up, as the mayor has mentioned as well. It's difficult to estimate. We know from the beginning of this pandemic in the United States that we're just capturing a small fraction of our true infected individuals. So we can say that there's 171 reported cases. We know that there's many more that have not been tested. And that's why it's so important for all of us to just realize and understand that community transmission is happening and that we all need to adhere to the recommendations that we're making to stay at home and to follow the hand hygiene and the respiratory etiquette recommendations.
So 2 more questions on testing. One is, do you have to have a prescription to get a test? And what is the wait time for swab tests?
So different jurisdictions have different processes. So in the city of Long Beach, the best way is to go through your doctor. And if you don't have insurance, you can call the 562-570 info line, and we can help guide you to a provider. But that's really the first step, and then the provider can either schedule testing themselves or they can refer you to the health department if that would be the most appropriate way for you to get tested.
And the wait time for the swab test and wait time for blood antibody test.
Yes. So first of all, blood antibody test is being used right now for research purposes, but it's not used for diagnosing COVID-19 at all. So we wouldn't use that. The swab test, it really depends on how backed up the laboratories are. So anywhere from 24 to 48 hour turnaround time to as long as 6 days.
Okay, Dr. Davis, questions on long-term care facilities. Why does the health department believe COVID-19 has appeared so quickly in 4 different long-term care facilities? And what are you doing to help prevent the spread in those facilities?
So the long-term care facilities in general, they're congregate living facilities. COVID-19 loves to go from person to person. So anytime you have a location where numerous people are in close contact with each other, especially if they're living together, that's a high-risk environment for transmission. What we're doing to lessen that risk and to really be aggressive in preventing transmission is putting a lot of resource into identifying sick and exposed residents and staff, and making sure that everyone has the proper protective equipment that they need and that they're following really rigid and strict guidelines for protecting themselves and protecting patients.
And then one additional question came in from online. Is Long Beach participating in any of the FDA drug testing or in the attempts to try to find an antibody for this? Or not antibody, but a
It
cure?
could be that our local hospitals and probably our academic centers in the area are working on clinical trials and a variety of research projects into COVID-19. A lot of resources are going into figuring out all of the different nuances, treatments, vaccines, prevention measures, and what have you. So I'm sure that Southern California, with all of our academic centers, is participating in that.
Okay, and then last question for Dr. Davis. With so many firefighters who have tested positive, has the health department found any evidence that they may have spread the coronavirus while they were out on calls or working with the public?
Up to this point, we have not identified that issue.
Okay, we now have a couple questions for Mayor Garcia. One question came in regarding the Mercy Hospital ship. How is that going to help Long Beach?
Sure. So the Mercy Hospital ship is really an asset that's for the entire region. And so while the hospital itself is anchored in the Port of LA, it is taking patients and overflow patients from all area hospitals. And so it's going to see individuals from all across the greater Los Angeles region. And people should note every single hospital bed anywhere in the state, quite frankly, in the country that's added to the system is good for us in Long Beach. We want not just Long Beach to be adding all this hospital capacity. We want that hospital capacity to be happening in Orange County, in Los Angeles, in all the other cities in the county and the region, because that way everyone has more capacity. We know that if there's someone that is sick in one of the cities in northern Orange County and they don't have access to a hospital, they're going to look to Long Beach. We know the same is true in Long Beach, in Los Angeles and other places. So we're all trying to work together. So I encourage everyone should be looking at increasing hospital capacity, and the Mercy does a huge help for all of us and here in the city. It's so close.
Mayor, we have a question from the media regarding the fact that there's no council meeting scheduled until after April 7th. And should the council be meeting by teleconference to discuss or vote on some of these important policy matters?
Sure. I think the city council is following the governor's new rules as they relate to public meetings. And so it's not just the Long Beach City Council that are not meeting in a public setting, but are teleconferencing in. But it is the city councils up and down the state of California, as well as other bodies and across the country. It is not okay to have council members bringing in dozens, hundreds of members of the public into a confined space at City Hall. They need, and they are setting, I think, a great example of physical distancing. And so the council meets separately, and we are following every single legal practice that the governor has put out as they relate to how we should conduct those meetings. The city council is doing and will continue to do so.
Okay, Mayor, last question that came in from one of our community members. How are you letting homeless people know that you now have shelters?
Sure, it's a variety of ways. I mean, first is there is a dedicated team of outreach workers that work every day with our homeless population. And so they're out there, they have relationships. They are talking sometimes to these individuals once, twice, 3 times a week. And so they get that information out as they're connecting with individuals. We're also working with our network of organizations, food banks, nonprofits, our homeless outreach coalition. All of our partners that work on this issue also are being made aware of the sheltering opportunities so that folks can go to shelter. And in addition to that, we are working with a bunch of business partners, other people in the community that are also spreading that information and news. But I want to just remind folks that some individuals that are experiencing homelessness can choose to not go to a shelter. And so that we would like folks to go into a safe space, but there are a lot of individuals, many who have incredible mental illnesses and who are suffering from from chronic homelessness that will still choose to be outside. And that's something that we are struggling with, that we're talking to the governor about, because at the end of the day, this is about public health and safety for everyone. And so we're working on that issue. We want folks to get shelter, food, access to healthcare, and the facilities we've opened up. We've been asked why MLK, why Silverado. The reason why those two were selected was because they have large shower facilities, and people are able to go and use the showers and get clean and get a hot meal. So that's been important for us. Great, thank you for those questions. We're going to now do a summary in Spanish. Y acá para decirlo en español, vamos a hablar del Departamento de Salud. Gracias.
Muy buenas tardes a todos y gracias por estar con nosotros otra vez. Queremos ahora darles los datos de todo y toda la información sobre COVID-19. Desde hoy tenemos 171 casos de COVID-19 en Long Beach, con aproximadamente 40 residentes que ya se están recuperados. Desafortunadamente, hoy una tercera muerte relacionada con COVID-19. Nuestros pensamientos y oraciones están con esas familias y también con todos los que están sufriendo con este virus. Por ahora, creo que también hemos dado cuenta de que esta crisis de salud, junto con los enormes cambios que están pasando, han traído también social y económicamente, nos acompañará por un tiempo, otras semanas más. Con todos, sabemos que las próximas semanas son extremadamente importantes en nuestra lucha contra el virus COVID-19. Por favor, queremos recordarles que sigan respetando las órdenes de salud y practiquen distanciarse físicamente. Hemos visto que todavía hay varias personas que se juntan en las playas, en los parques, y es muy importante que sepan, recuérdense que esos lugares públicos están cerrados y que es muy importante que hagan de su parte para poder protegerse a ustedes, a sus familias y a la comunidad de Long Beach. Estamos haciendo todo lo posible para combatir estos desafíos y continuaremos atendiendo a los más vulnerables de nuestra ciudad. Esta semana la ciudad abrió otro refugio temporal en el Parque Martin Luther King en la ciudad de Long Beach. Todos nuestros esfuerzos están para proporcionar refugio adicional a los necesitados durante estas crisis. Recuerden también que a veces algunas personas que están sufriendo en las calles y que no tienen dónde ir, a veces también nosotros respetamos cuando ellos no necesariamente quieren ir a un centro para quedarse temporalmente. La ciudad está planeando también tomar otras medidas extensas para prepararse para una posible afluencia de personas que buscan atención médica en respuesta del COVID-19. Esto incluye como carpas, hospitales movibles, clínicas en el centro como en el centro de convención de Long Beach, también otro hospital móvil en el colegio de Long Beach City College. El centro también para identificar estrategias para poder ofrecer más pruebas del virus también. Vendrá más información eso en el futuro. Nomás queremos decirles que estamos en muchos planes están alrededor de esas pruebas y para traer más exámenes a la ciudad. Queremos asegurarle a nuestra comunidad que estamos haciendo todo lo posible para mantener a Long Beach lo más seguro posible. Nuestro equipo de epidemiología continúa investigando todos nuestros casos positivos de COVID-19 y ahora estamos compartiendo información sobre centros de atención de largo plazo que han tenido casos positivos también. Les recordamos que miércoles, cuando dimos esas órdenes de salud, es muy importante que las personas se autoaíslen y que aquellas al riesgo también practiquen el autocuarentena. Ha habido muchas pláticas también en la comunidad, tal vez como ustedes ya saben, y en el resto del condado de Los Ángeles, sobre las máscaras para protegerse la cara. Queremos decirles que pueden usar una cubierta facial cuando salgan a hacer sus compras, por ejemplo, pero recuerden, cubrirse la cara no es un sustituto de otras medidas críticas de prevención. Las más importantes son quedarse en su casa. Esa es la más importante y también, como los hemos dicho, lavarse las manos con frecuencia y practicar el distanciamiento físico. Más información sobre las cubiertas las faciales que puede hacerse con unas telas como el algodón, por ejemplo. Ha habido mucha plática sobre eso también. Pero también queremos recordarles que los recursos médicos, las máscaras médicas N95 queremos recordarles que son reservadas para los centros médicos, para los hospitales. Es muy importante porque no hay muchas de esas máscaras ahorita por el momento, por favor queremos recordarles que no compren las máscaras que se estén usando en los centros médicos. Una cubierta facial no lo protegerá completamente del virus, pero puede ser muy beneficioso usarlo como para cuando hablemos, cuando estornudemos o tosemos, protege con esos fluidos y pasárselos a otra persona. Es todo por ahora. Muchas gracias.
We want to thank you again for watching this update. Please share it with family or friends and the information that we have. And we'll do the next update, of course, Monday at 3 o'clock. Thank you for watching y muchas gracias también por estar acá. Thank you.